This is the FM Gold channel of All India Radio. In the program Spotlight, we now bring you a discussion on awareness over COVID-19. The participants are Dr. K.K. Agrawal, former President, Indian Medical Association, and Pradeep Surin, journalist.
Today is a very important day. This is the day when 220 people who were quarantined after their return from the coronavirus hit China are going to be back in their home after 14 days. When the people are talking about the coronavirus, there are so much issue related to it. People are talking about how it spreads, what kind of deadly virus it is, and how it can affect you. Dr. Agrawal, I would like to start with the question, what is coronavirus and why it is so important at this point of time?
So first of all, namaste. Let's all spread the message of namaste, because if we really want to tackle corona, we first need to tackle flu-like illnesses, which spreads by shaking hands. As far as coronavirus is concerned, the word corona comes from crown, coronary arteries we all see in our heart. So therefore, any virus which looks like a crown is a coronavirus. 10% of our cough and cold and fever is because of coronavirus, but this coronavirus has become a terror. Previously, two terror forms of coronavirus was SARS and MERS. Now this is COVID-19. How long it will last, we don't know. It may become a hit-and-run virus like SARS. It may persist like swine flu, which is H1N1. The time will tell us. But good news is, at this moment for the last 4 days, new cases are declining.
Got our news that there were 3 positive cases in Kerala. 2 are found negative now. They are free. They have already gone home. But there is one person whose reports are awaited. How you see it? Can we defeat this virus?
Absolutely. As far as India is concerned, we have not allowed any new virus to come in the country. The government is doing its job. Specifically, kudos to Kerala government, where 3 cases came and all 3 of them, they turned them into a mild cases and they have totally recovered. But remember that 85% of the cases will be mild cases and 2 to 3% of the cases may become fatal. So it's 2% mortality. For every 100 people, 2% will die. Will not affect the children less than 15 years of age. But the average age for death is between 50 and 60. So therefore, those people who are above 60 with comorbid conditions, obesity, blood pressure, diabetes, these are the ones, they are developing breathlessness, pneumonia and dying.
So World Health Organization is already taking care of lot of precautions related to it. But why WHO have actually taken too much time to declare it a medical emergency? And beyond that, why there is no vaccine as of now for this virus?
See, no vaccine can come in less than 18 months. No pharmaceutical would be interested in making and spending billions of dollars if it turn out to be a hit-and-run virus. Many people have donated a lot of money to see to it the vaccine is made. The earliest vaccine can be 8 months, 9 months and 10th month. It will not happen in 3 or 4 months. That's one thing. As far as WHO is concerned, they have still not declared it as a pandemic, though it is a pandemic alert, because pandemic has 6 phases. It qualifies into the 5th phase of pandemic alert. So therefore, if it becomes a focal spread outside China, then it has to be declared as a pandemic. As on today, it is a public health emergency of international concern. On 10th of this month, even Kerala took away emergency as far as Kerala was concerned, because 3 cases turned out to be mild cases.
Dr. Agrawal, there are almost 1,868 cases which are already dead in China, and more than 72,000 people are confirmed contaminated with it. Now, when we are talking about the China, there are so many reports which are directly indicating that virus cannot survive in the temperature of more than 30 degrees Celsius. Could you just elaborate?
See, if it was true, because the virus is not coming in Africa because of the hot atmosphere, but this may also be that they have not been able to diagnose it. Even Indonesia, we haven't got a case.
Yeah.
But if you see other countries which have high temperature, say Malaysia and Thailand, there number of cases are there. But yes, if you go by the definition of a SARS-like virus, which is 60% matches, it doesn't like humidity, it doesn't like sunlight, it doesn't like heat. So that's the reason, as the temperature grows, the virus may become less effective and less virulent.
As of now, the government reports is also indicating that there are 2,431 cases Indians who are under surveillance.
No, they are the contacts. Somehow or other have been in contact with a positive 3 corona cases, and or they have come from China. They are under observation. So remember certain numbers. Asymptomatic period is 5th day. 9th day is the time to become breathlessness. and 14th day is the time to death. So therefore, if a person who is in contact and if he doesn't develop a disease because the incubation period average is 5.5, though we are doing a 14 days quarantine, but anybody who hasn't developed a disease in 6 days, practically we take it up that he's not going to develop the disease.
There are some reports also indicating that there are no sign of any coronavirus. Maybe it's a positive one, but then also there's no sign. Maybe he's not sneezing.
No. If it was causing spreading of an infection in an asymptomatic state or an incubation period, it could have caused an havoc by now. So there were one study where one person was supposed to have spread it to 5 people who was asymptomatic, but later on it was published that case was symptomatic. So at this moment it is debatable that asymptomatic patients causing corona. At this moment we are talking about only those cases who have cough will spread corona. Without cough you cannot spread corona.
Recently Prime Minister Narendra Modi praised Air India and hospital entire group. How you see the challenges within the doctors, within the teams who are taking care of these quarantine patients or these people?
If you see the China statistics, approximately 3.4% healthcare workers also have got infection. But if you remember our oath in Medical Council of India, now a National Medical Commission, it's very clear that as a doctor, our dharma is irrespective of an epidemic, our job is to serve. Therefore, Narendra Modi ji, our Prime Minister, said that they have done a good job. The same job has been done by the Kerala Ministry, and all the doctors in the country are ready to face if any such eventuality develops. I don't think so any doctor or healthcare worker would say, we are not going to treat corona patients. It's like an army. It's like you have to face that. And we have to give a credit to China also. Yesterday, we had director of Wuhan Hospital. He died. The first whistleblower who was an ophthalmologist, he also died. That's what our profession is. Our job is to treat. I only want to add one thing. It's an opportunity that we have Trump coming into our country in Ahmedabad, and Kemcho Trump has been shifted to Namaste Trump. I think this can be a big campaign in India when we talk about Namaste and we take away the habit of shaking hands, and all diseases like flu-like illnesses will go away. Remember one thing, if you want to get rid of corona, get rid of flu. And for getting rid of flu, we need to learn Namaste and wash our hands whenever we are touching something.
In every flu, there are so many advisories and so many advices from doctors. How you will define it, how to treat it, how to avoid coronavirus? Is mask is the only thing or hand washing is the only concern?
See, there are two types of infections, heavy virus and light virus. Corona is a heavy virus. Heavy means size is more than 5 micron. So therefore, if I cough or sneeze, it will not go beyond 6 feet. Average is approximately 3 feet. So it will settle down on the surface. It will not stay in the circulation. So therefore, if a person is coughing, sneezing with fever, remember, no fever, no flu, no fever, no corona. So if I have fever, if I am coughing, then somebody else should be at least a distance of 3 feet from me. So therefore, in a hospital, you have 3 feet distance between two patients. Therefore, if you are sitting in a first class flight or picture hall, the distance between 2 seats is minimum 3 to 6 feet with that. Number 2 is the person who is suffering should wear surgical mask, and the person who is handling the virus, labs, doctors, they should wear a N95 mask because you need to protect yourself. If I am a patient, I have to protect others, therefore I must wear a surgical mask. If I am in a close contact, yes, I must wear a surgical mask. In a bus, in a public place, surgical mask should be available in plenty so that if somebody has a fever and cough, he wears it. IPC 270, it's a criminal in India that if I am having a fever and I am having a cough, I'm going to a public place and spreading the infections to others. But nobody uses it. People say flu hai to kya ho gaya? But remember, flu also kills. In India, flu kills a lot of people above the age of 50. The number one cause of elderly people dying in winter is flu pneumonia. This is a time, an opportunity. Every adversity is an opportunity. An opportunity for us to learn droplet infection control program.
There are so many concerns related to the awareness of the virus, like you when you're talking about the IPC or when you're talking about the criminality of this issue. Most of the people are lacking is the monitoring of the disease or sometimes how to track this issue. How you define the specific health worker to take care and monitoring everything related to it?
Simple answer. Droplet infection needs to be prevented like a universal precautions. As we have universal precaution for HIV, we need to take universal precaution for anybody who is coughing, sneezing and having fever. They must be given free paid leave. The school children must be given educational leave. Otherwise, what you're going to do is, if you're not being given a leave, you are going to come back and infect others. Remember, most important thing is self-quarantine for 14 days. You have cough and cold with fever, self-quarantine yourself for 14 days. To protect members of your family, wear a mask. No breathlessness, no admission, no breathlessness, no testing. It will become alright over a period of 14 days by itself. Take a vaccine as far as flu is concerned so that you don't have to suffer.
Dr. Agrawal, getting all the information related to China, one thing which was actually area of concern for the entire world, including WHO, was the underreporting of anything. Last time you also know about it, that 2002, 2003, the SARS effect was the larger than how China was reporting it. Now there are so many doubts related to it. Do you think that there may be some...
I don't think so there is any doubt. The reason being, in India also, you underreport dengue. You say, I'm only going to take positive cases and that too ELISA cases, clinical diagnosis, suspected cases and then rapid tests. I'm not going to take. Similarly, China was taking only confirmed cases. Then on 12th of this month, they started taking CT positive cases. But still, those cases which are CT negative, CT positive means 20% of them, 80% of them may not have involvement of CT. So therefore, you can add another 80%. Therefore, the fatality of 2% actually may be higher. It may be much lower than that. But what I want to give, the most important thing is, I want to give credit to China. Specifically, the way they have quarantined 5 crore people, the way they are built up 2 hospitals in 10 days time, the way their workers are managing their cases. Let's not create myths. Remember, medically, the virus has been genome down. It is absolutely like a coronavirus. It's not a genetic virus. So let's not create fear. Let's support China in its movement. Let's show our solidarity to China.
I'll ask you one question related to traveling, and there are 2 very small questions which are related to traveling, and another one is food. A lot of people are traveling to different airports and different railway stations. What kind of basic 2 or 3 requirements are there for each traveler so they can get proper precautions?
So when we travel, there are 4 types of warnings: L1, L2, L3 and L4. L1 is general precautions. Wherever you go, whichever country you go, whether you are in a bus or a train or a flight, you follow L1 precautions. That means if you have fever and if you have cough and cold, don't mix up in the public. And if you find anybody, let him wear a mask. L1 precautions. L4 precautions are don't go there. Like UK said to Chinese, come back permanently. US said no more going to China. That is L4. L3 was, which India has given for China, that before you go to China, think whether you really want to go, weigh the pros and cons and then go. So in India, L3 is for China, but L3 is in India within, say even in Kerala, level 1 warning only. And L2 warning is slightly higher than L1, that you take precautions. Suppose somebody says in Thailand there are 20 cases, it's L2. Let me take precautions. As far as India is concerned, L1 precautions, general universal precautions. If you want to go to bus, wherever you want to go in a public place, take universal standard precautions.
Dr. Agrawal, you came here and you have given us such a wonderful information related to coronavirus. I'm sure most of the people will get a lot of positive aspects related to it and they will be healed very soon. Thank you so much.
Namaste sab logon ko.
You were listening to a discussion on awareness over COVID-19. The participants were Dr. K.K. Agrawal, former President, Indian Medical Association, and Pradeep Surin, journalist. This program was produced and presented by the News Services Division of All India Radio. This program is also available on our website, newsonair.com. You can also follow us on the News on AIR app for updates. You may email your opinion about this program at airnsdtalks@gmail.com.